Anxiety is a psychiatric disorder that widely prevails across the world. It is a constant sense of concern, fear, or worry. There are many disorders that come under the term anxiety: panic disorder, separation anxiety disorder, selective mutism, phobias, premenstrual dysphoric disorder, PMDD, and generalized anxiety disorders are different types of anxieties. It makes day-to-day life difficult for the person and people around them. Anxiety causes chronic stress and leads to many physical disorders and diseases. In a healthy person, upon exposure to stress, adrenaline hormone is released. This leads to a faster heart rate and breathing, dilation of pupils, and increased levels of blood sugars. This in turn leads to release another hormone called cortisol. Cortisol suppresses the immunity in order to save the body resources to rescue itself from the cause of stress. In a person with anxiety, these hormones are constantly released, causing continuous responses of increased heart rates and suppressed immunity. Further, this leads to increased susceptibility to heart diseases, diabetes, allergic reactions, and other disorders. Anxiety is symptomized by inability to control fear or worried feelings, difficulty in concentrating and irritability, difficulty in sleeping and restlessness, constant fatigue, increased muscular tension and pain, sweating, especially palms, feet, and forehead, racing heart. Anxiety can be caused by traumatic or life-changing events, physical abuse, mental abuse, substance abuse, excessive consumption of caffeine, genetic factors, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are classes of antidepressants generally used to treat anxiety. SSRI prevents the reabsorption of serotonin, the happy hormone, so that there is more serotonin available in the brain. SNRIs help in secretion of serotonin and another hormone, norepinephrine, a mood-regulating hormone. Beta blockers, used to relieve high blood pressure, usually can be prescribed for anxiety, as it also helps to control trembling, blushing, and increased heart rate. Benzodiazepine, a slightly addictive drug, can be sometimes prescribed in severe conditions. It enhances the function of gamma-aminobutyric acid, GABA. GABA helps in relaxation, sound sleep, and mood changing. Non-drug treatment may include counseling, hypnosis, exposure therapy, brain stimulation therapies, alternative therapies, exercise, and medication therapies. Self-care is important to control and treat anxiety. Limit caffeine-containing products to 1 serving per day. Caffeine increases blood pressure and heart rate, worsening the symptoms of anxiety. Replace coffee or tea with other non-caffeinated beverages. Avoid alcohol completely. Continuous sound sleep for at least 8 hours is essential for mental and physical relaxation. Make sure to maintain a schedule for sleeping and waking. This keeps the body clock maintained, which is essential for neurological functions. Indulge in recreational activities, sports, and art of your choice. It creates feelings of self-esteem, satisfaction, and positivity. Work out at least 5 times a week, depending on your convenience. Exercise helps in release of endorphin, a neurotransmitter that makes us feel happy. Yoga, meditation, and massage have proven benefits in relieving stress and anxiety. Try one each day. Going out in nature and open surroundings can help get rid of irritation, anger, fear, and grief. Social gatherings and spending time with loved ones, talking to them, can make you forget about worries. Taking care of loved ones having anxiety can be difficult at times. Be a patient listener with the person having anxiety. Do not take anything said personally or react. Do not judge the person. Be empathetic and do not give any advice until they request you. Speak in favor of the person even if they are wrong. Later, you can show the consequences completely. Seek medical help if the episode of anxiety prolongs more than 2 weeks. Encourage the person, but do not force to go out in social gatherings. Encourage the person to express the feelings of anxiety like fear, worry, and anger. Soothing music and fragrances can be mood-changing and relaxing. Encourage the person to travel or learn a new skill. Do not constantly converse on the subject of stress or stress management. Distracting the person with other interesting conversations and surroundings can be helpful.